I'm joined today by a team of experts from various sectors of the medical profession to shed some light on the coronavirus pandemic. There has never been a more pressing time to find out how to stay safe. So let's take a look at coronavirus myths and facts. One, saline, garlic, and sesame oil prevent coronavirus infection. Have you guys seen this one? It's just been all over the place. I think we can label that as a myth, right?
Absolutely.
That there's no vaccine to cure COVID-19. That is a fact, correct? But there's one being worked on.
Yeah, there's 2 or 3 being worked on, yeah.
But the timeline would still be, what, months,
Yeah.
year,
Yeah, months.
longer?
At least.
Number 3, face masks will protect from COVID-19. That's a myth, correct?
Absolutely.
Unless you're a healthcare worker, real up close with a COVID patient, you are not going to get infected by what's in the air, okay? So a mask protects you from that, and instead you're going to get infected by what's on surfaces, on your hands, and what you do.
People may notice that we spread the chairs here as an example of what people mean by social distancing. We don't have a studio audience in here today because, again, concentration of people, and if there's someone that is infected, they could easily spread it. But before we came in, all of these surfaces were wiped down with disinfectant. Everything was cleaned and wiped down. Same in our control room where everybody's working. We at least start fresh when we come in. Now, if you guys were carriers and came in here and you've put it on there, then that's on you. But it was clean when you got
Clean
here. That's all I
afterwards.
can say.
Yeah.
Not a chance. Not a chance.
All right. So 4, infected people have traveled enough to spread the outbreak globally. That's a fact, right? So Italy has shut down Italy, but have they really? I mean, we've got students flying in from Italy to JFK and they're saying, we're not really being checked on either end. And so they're flying into the U.S., getting off the airplane and just going out into wherever they're going into the U.S.
The horse is out of the stable by now. I kind of feel like it's probably not helpful to think that we can have any real effect by kind of focusing on the countries that have the highest number of cases. I think it's probably more effective to just accept we've lost round 1 against this virus. So now we're in phase 2. It's here. It's probably not in massive amounts in many communities yet. And by practicing all the things that we've been talking about, being mindful with your hands, being, considerate, staying a little bit away from people, maybe reducing, social interactions, we can help slow it